Welcome to the Coaching and Therapy channel. So this channel is quite close to my heart because I train coaches in embodiment. I mean, why? Because if you don't work with the body, you're missing a lot. Whether you're a coach, a therapist, facilitator, whatever, that's how you go deep quickly. That's how you do stuff that's sticky. We have to take the body into account. This channel is sponsored by Dylan Newcomb and Uzazu Embodied Intelligence. Dylan is a genius, quite simply put, and I wouldn't say that about many people in this field. I've been studying with Dylan for, God, the first time was probably 10 years ago in the Netherlands. Speaks fluent Dutch, by the way, as well as Korean and a few other languages. What I love about Dylan is his ability to make models of things, looking at how embodiment works. His system, Uzazu, U-Z-A-Z-U, is really all about state shifting. So I think of him as the sort of master of state changing, how we can shift our state, our client's state, and how we can develop ourselves through those different ways of being. So I think for coaches and therapists, it's like easy to learn, practical toolkit. I've used it myself over the years. So if you want a 3-day online training with Dylan, then look at the link below, or you can go to Uzazu, uzazu.org. And even easier, he's got an embodied assessment there you can do as well. We all love doing these little tests about ourselves, but this is an embodied one. So there you go. Welcome to the Coaching and Therapy channel. I'm going to be on this one a lot just because there's lots of cool people on here. Lots of people, I think, well worth a listen. Embodiment in facilitation is so necessary. So from me to you, welcome.
The session is Breathwork as a psychosomatic boost, a self-help tool for cancer patients, and your presenter here is Alicja Heyda. Over to you.
Hi everyone, it's great to see you here on this immense Zoom session. I am an old psychotherapist, let's say with over 20 years of experience, and I have been spending my days at cancer center, Gliwice, Poland. And when I entered this place for the first time at 2000, I was a breathworker who has just completed a body psychotherapy course in Strasbourg. And I asked myself a question, how I can be useful in this place where people get cured or not, but they are supported at every stage of their disease. And I realized that breathwork seems to be the most effective method out of all. Many therapeutic styles are not useful at the oncology. You cannot scream the way you may scream at primal scream. Dancing is a bit limited. I did trance dancing with the patients, but you need a place for it. So sometimes it's possible, sometimes it's not possible. What I needed to support them and give them possibility of free emotional expression and to be able to share freely what they need to share, and to support them in symptoms, in relieving the symptoms which might appear during radiotherapy, chemotherapy, chemoradiotherapy, before surgery, after surgery, during diagnosis, magnetic resonance. So breathwork has helped me to, and has helped patients to deal with claustrophobia, nausea, anxiety, panic disorders, everything that made their life miserable in the context of oncology treatment. I always create certain general platform telling cancer patients what do they need to survive the treatment optimally without pressure. What you need is supportive environment and people who love you. This is the safety net on which we can build. Yeah. What you need is a possibility of rest and taking time for yourself, and possibility of cutting off toxic people. We are mammals who need relationships. Without love, touch, and closeness, at the range you need, we have all different needs of closeness and of being touched. it's very difficult to recover. I will talk later about neuropsychology, neuroimmunology of healing and recovery a bit, and it will show up. These basic needs should be satisfied before you go to advanced practices. And in general, whatever you do for yourself, is it dancing? Is it walking in the woods? Is it hugging your dog? Everything you do for yourself during the treatment diagnosis and after treatment is priceless. Every kind of authentic movement, mindfulness. I know it is simple, but it's crucial at the beginning when our mind is jumping like a monkey. Oh, am I going to die? Is it difficult? How am I to survive this treatment? What treatment I should choose? Maybe I should try something magical from under the table or not. When everyone attacks you with their diet advice, when people are pushing you to do what they want you to do, when they are crying for themselves in your presence because they are afraid about themselves, not about you. These are the context we have to take consideration. So what I'm thinking, anything you would do for yourself on every stage of your disease is totally necessary, priceless, and this is the time of being a little, it's not true, but egoistic or self-centered, to give yourself a chance to recover, to be cured. If you need to get an information from medical team, please write down your questions, write down your symptoms. The patient who is stressed out will remember 10% of an information in a stressful situation at the hospital. So take someone with you. While waiting for the visit, please plug your ears. Do not listen to other patients. Patients are scared. They are creating myths or suggesting unwise things, let's say. Or they are projecting their fears and their anxiety and their hate and everything on the doctors, and they are describing the medical team accordingly. So to avoid this massive hell of projection, bad emotions, someone else's panic, please plug your ears, put on the music, and hug somebody or hug yourself. At least virtually in your mind. Yeah. These are the basic things, but they are easy to be forgotten. It's difficult, I will be joking, of course, to meditate on unicorns in the sky when someone in the background is saying, oh, we are going to die soon, this doctor's treatment is not so good, this cancer center is not right. People are saying these things constantly. Yeah, while facing the cancer diagnosis, we are confronted with something that hurts our narcissistic ego, closeness of death, constatation that things are not permanent, yes, that we are not going to stay here forever. This is scary, and this is both existential and precious experience, but also you can be put in your panicky mode. And while talking about panicky mode, I always suggest basic things at the beginning. So please, if you would like to get calmer, just slow your breathing. Slow your breathing. Inhale slowly, for example, for 5 seconds with your belly and chest. And let go without pushing. Inhale. Up to your lungs. Slow exhale with your nose. Several breaths again. give yourself few minutes of coherent breathing, and you can download a free app by International Breathwork Foundation, brilliant thing, where you can switch to slow coherent breathing or to a little faster mode for free, and it will help you. IBF breathing app. A lot of my patients who do not know English, they use it and they benefit from it. So it's so easy, you don't need anything, just click and take a look. Your nervous system will calm down. And if you have a tendency to be panicky or claustrophobic, if you're getting really panicky, don't hesitate to search for medication, please. This is the crisis. And there is this technique of gas mask, as I say. Please breathe into your hands to increase your carbon dioxide levels. Inhale, exhale. I know it's strange, but it is much better than breathing into a bag. Do not try breathing into the bag, please. It caused a bit, several accidents. You may pass out. So if you breathe into your hands while in panic, you increase carbon dioxide quickly. And if you are very nervous, you may be unable to control the rhythm of your breath. So for the beginning, start with the mask, and afterwards, if it's better, please switch to slow, coherent mode without pushing on exhale and using your nose if your nose is working. If your nose is not working, try through the mouth. You don't have a choice. Yeah? Or if you have tracheostomy and you cannot breathe with your upper airways here, just slow your breathing and put your hands a little bit far from tracheostomy and breathe slowly. It sometimes happens after large surgery of head and neck cancer that people are waking up covered with, pipes, little pipes, bigger pipes, tracheostomy, everything might be scary. So before any operation, ask your doctor about details, because every informed patient will be recovering better, and the anxiety will be surely smaller than in case of being uninformed, being put in chaotic experience. Yeah? But generally, I have really holistic approach, but during the real crisis, don't hesitate to ask psychiatrist for help, please. Don't hesitate. Give yourself time, give yourself several weeks if you need it. Well, it was just general advice. I would like to start my presentation now, and it contains triggering material. Okay, there are cases of my patients. I have probably consulted thousands of people, and hundreds had deeper therapy and contact, and these are some of these people. So I will refer to their successes and achievements to help you out in case you will be in the similar situation. Okay, now I will try to share screen. Okay, one moment. Okay, so a moment. So if you didn't know, ancient healing and spiritual exercises called breathwork now, or pranayama, were known from centuries. Some of them were created during development of early psychoanalysis and psychotherapy. That's a funny period that deserves a separate seminar. But in general, during the last 20 years, a growing body of evidence has shown us that breathing methods are important. Yes, and there is so much research that will help us to translate the language of ecstatic breathwork experience into the common language for people who would like just to start, to get better, to recover better, to feel better. Okay. You don't have to read this. This is maybe for later, but I would like to say something about our nervous system. Emotions and breathing patterns are dependent. They depend on themselves. When your breathing pattern is changing, the state of your nervous system is changing too. In general, slow breathing techniques are calming down, are activating parasympathetic nervous system. So you are able to feel calmer, more relaxed, and feel more rest. All methods which are more rapid when there is more breaths than about 15 breaths per minute, they will activate sympathetic nervous system, giving you a power, stamina, strength, mana to move on, energy to start. It will increase your motivation. Middle rhythms, including coherent breathing, they will balance the activity of parasympathetic and sympathetic nervous system. So there are many methods and wonderful teachers of breathwork who are having yoga origin or body psychotherapy origins, many embodied practices. You may just find the method right for you. For the beginning, I suggest 6 breaths per minute through the nose. Using whole of your body when we breathe. Can you see the animation? Is it working? Oh, okay, fantastic. I love this animation. Most of us during socialization lose the ability to breathe fully and freely. And when we breathe in, we just we put our belly in, and all air is in our lungs up here. This is the fight mode, and to breathe freely, you need to start from your belly. So it's not elegant, but it is safe and effective. And these are 2 things I really care for. Okay, now we will dig into the rabbit hole of my way, looking for what is right for the patients, how to research it, and what to do with this. I met a lot of people at the beginning of my oncology career who showed me where to go and why. And now you will see a lot of patients' drawings showing their therapeutic process. Okay, there was this nice young girl who was having recurrent disease. She was unsupported. She was abandoned in her childhood. Family took her back to benefit from her cancer pension she received from the government after first treatment. She was depressive. She had heavy nausea during chemotherapy. And I asked her to draw her impressions, how she's dealing with the disease, how her body is handling it. Can you see that the good forces are smaller than the bad forces? And while she was breathing, she cried a lot, and she expressed love to her mother, despite her mother wasn't quite effective or their bond wasn't quite sane. And something changed. Something has changed. She had an impression that her lungs are crying with black tears. And at the end of the therapy, she felt so much better. She decided to marry the boy she loved. Family didn't like him because he wasn't rich. and he was a bit disabled, but they live happily. And she was very, very sick, but she's healthy. Imagine. Something has changed during cancer treatment, and it's not obvious that it has worked. Yeah, she has just allowed herself to breathe and to admit that she loves her mother despite everything. This is the bond she needed to be cured. This is my, let's say, clinical conclusion. And I was happy to accompany her, okay? So search for a bond during your cancer treatment or any heavy treatment. Express your love to those who you love despite anything, yeah? Because nobody's perfect. My other patient, he was an alcoholic, lovely miner, who was smoking a lot of cigarettes and was missing alcohol, large amounts of beer during radiotherapy of the throat. Can you see, cancer in Polish is the same as the crab. You see this in his mouth. Yeah, in German too, Krebs. Yeah. And he felt a lot of pain. You can see his tongue on his head with fire and pieces of iron, and he was scared. And we started breathing, and I asked him, could you please breathe if you drink, as if you drink beer with ecstasy, with a bliss, or had a smoke? So he kept on breathing, imagining drinking beer at the balcony and smoking with this bliss in his head, and his anxiety diminished quite soon. He had strong archetypic dreams of being cured, and while he was breathing, usually you can see the vocal cords, which are drawn as the piano chords. He felt bliss, which was healing his pain. I will later show you neurological connections, why he had this pain release. But he had dreams of being cured, and he was cured indeed. Yeah. Yeah, but if you have an addiction problem while being cured because of cancer, please try to contemplate your smoking as if you were a king of the world. Smoke and breathe slowly and enjoy it. And you will reduce the number of cigarettes in 24 hours by the half. Smoke as if you were the king of the universe with arrogance. Could you please just and breathe? Yeah, this is the beginning. And while exercising breath work, remember the bliss that your addiction gave you, but don't start drinking. Yeah. This impression in your brain will help you to express and feel bliss and everything nice without taking in the substance. Yeah, but this is the beginning. This is the small exercise which might be used in case of any addiction, I think, if you want to start being free. Of course, you may need a professional if you are addicted to drugs. But with alcohol and nicotine, I can deal perfectly while working with my patients this way. Okay. My other patient who was very advanced, this cancer was very, very advanced. You can see the nasty dog, which is personification of the cancer, which is eating out his neck. And he had dreams of fighting this dog. And while we were breathing rhythmically in a circular, loose way without pushing, he had this experience of the dog that came back, and he had experience of light. And every session there was more light and less cancer. Can you see the other picture? This is after a couple of weeks of heavy chemoradiotherapy and our therapeutic work. So if you have a strong dreams about your disease, this is practical. Express it, please. Picture it, draw it down. Tell yourself a fairy tale about the hero who needs to, I don't know, contact your inner demons fight with them, or maybe they need to be fed with something, they need feeding to be let go. Yeah, it depends on the personal process. But fighting with cancer is not fighting with cancer. Sometimes it's a conscious integration of self, yes, of disembodied psychotic parts of ourselves that are away from us. They seem to be demons, emotions we cannot control, inner processes that seem to have their own life. Yes, it's the dog here. All right. There was a boy whose healing process deserves a whole seminar, but this boy was so ill that we were sure that he will not make it. Yes, because the cancer was infiltrating bones, and it was a horrible cancer. He had this kind of visual experience of his healing, and he was drawing the whole series of pictures to battle the disease. And what we can see here, his fiancée, his young fiancée, loved him so much that she spent all days with him, and they were doing this imagery of dissolving disease, of battling the dragon. He was dreaming about Saint George and the dragon. So I used all these archetypes in his work, and they were together in it. And he was healthy. And now, after 17 years, he's still healthy. Yeah. So even if the situation is hopeless, you can you always have time to give up. So don't give up. Enjoy your life as much as you can. Love as much as you can. Express yourself and be as eccentric, uncompromising, oversensitive as much as you want, as you need, as you can. All right. This is my lovely patient. He asked me to take this photo, okay, and he allowed me to show you this photo. This is the process of radiotherapy. The patient is in his mask, and you see, he cannot move. He cannot move, and it is a difficult experience for everyone. But he had claustrophobia, post-traumatic disorder, and depression. And at the beginning, he ran away from the other hospital because he couldn't stand this type of treatment, and he needed this type of treatment desperately. So we took 2 sessions of 30-minute sessions of coherent breathing, but in a loose way. You know, when he was tired, we did 1 minute rest. Yeah, and when he recovered, we started again and again, and half an hour. He was able to go with me to have this fraction of radiotherapy. I gave him this method of coherent breathing. I told him just to start breathing from his belly while he's immobilized, and slowly, slowly take the air in and focus on air. Yeah. And he had this inflated glove, which was the substitute of my hand because I couldn't be with him during irradiation. So he held my hand here. After, and he received a medication during the first fraction to be able to lie down. And after the first fraction of radiotherapy, he resigned, and he followed whole treatment without stopping, without panicking, and without medication. He only had antidepressants, and we had a lot of therapy, and now he's depression-free, and he has no PTSD, and he's healthy, and he's happy. If you have radiotherapy and you are claustrophobic, focus on your breathing. Ask for a medication if you are really panicky, okay? Slow down your breathing, and remember, it will take only 15 minutes. And if you slow down your breathing, your body will not switch into total panic mode. Yeah. And you will be able to recover after receiving all all fractions of radiotherapy. Yeah, radiotherapy has every patient receives certain dose of irradiation, and it is cut into small pieces you receive every day. This is a fraction. Yeah. All right. So don't be afraid of medication, and just slow down your breathing, go into coherent mode, and you should be able to make it. Yeah. Take inflated glove. Every patient with claustrophobia loves this. Children usually have 2 inflated gloves at our center when they arrive for radiotherapy from Children's Cancer Center. Right. Sometimes cancer is not the worst experience of a person who's going through a difficult time. My patient had to terminate a pregnancy to follow with the cancer treatment. It was a long time ago. Now it happens rarely that a person needs to terminate a pregnancy, but at that time, it happened. So she was so depressed and so panicky that she stopped the treatment, and she spent 2 years without going out. And she was drinking too much, drugs from psychiatrists didn't give her any release. And when she was submitted to our clinic for another treatment for recurrence of cancer, she started breathing deeply in my presence without any control. Catharsis is not waiting for anyone's permission, yeah? So something in her felt safely in my presence, and we went through several sessions, and she was free, and she was happy, and she has no panic at all, and she adopted 2 children and lives happily ever after, despite it was a recurrent cancer. Right? It was 2001, so long ago. I will be talking about immunity later. This is the case of helping someone who could not be cured. She couldn't be cured. She was a surgeon, completely aware what is happening, and she had a large tumor on her back, which filled her lung. Very, very large. She couldn't lay straight, and her lungs were filled with the fluid. So she was referred to me because everyone knew I do breathwork. So we started breathing, and a lot of fluids went away. Yeah. And she's starting to feel better. She stopped to have any pain. We had 22 sessions for 3 months. It was completely palliative treatment, but the tumor almost disappeared from 20 centimeters long. It was 10 centimeters long. She was even referred to surgery, but she died suddenly without suffering. She just left her body, and it was great news because in the other way she could just painfully drown in her own lung fluid. So I help a lot of people. People who are in at the end of life situation or in palliative care, and you can do a lot breathing, being with having compassionate heart, and accompanying somebody who is not afraid to share and to share all thoughts which might be considered dark or inappropriate for the family. Yeah. So if you have someone at the end of the road, please just be there, be compassionate, maybe breathe. Don't push to do this person to do anything that this person wouldn't want. Yeah. You saw the pictures of this a boy. We had about 30 deep breathwork sessions, rebirthing breathwork, breathing sessions. It was a lot of work while he was experiencing light, shaking, deep vibration, external vibration, and he was feeling better and better despite heavy treatment. And he recovered. And I asked myself how it's possible. So I started to search possible triggers, yeah, and I followed the white rabbit. What did I found? I found natural killer cells, which are responsible for killing cancer cells. There are many ways of killing cancer cells, but these ones, they are our inner army. Yeah. I was looking for what is really helping to activate natural killer cells, and I saw active drumming, laughter therapy. Laughter therapy is breath work, emotional expression, trauma disclosure. I found several works on breath work. Verbal psychotherapy doesn't seem to work as we need it to work in this case. It's a large subject. So after finding out that in yoga, for example, it was the Toriumi research, in yoga, only in case of active rhythmic deep pranayamas, natural killer cells activate, not during physical exercise and not during relaxation. That was the sign. Yeah, it is a small study. I realized that somehow the brain must activate. Some hormones must be released, and I refer here to psychosomatic network theory by Candace Pert. To cut things short, we are the universe filled with flying winged keys. They are looking for the keyholes. These are molecules and receptors. So to feel bliss and to feel endorphins, endorphin keys must find the doors, the keyholes for the endorphins. So we are the universe full of winged keys. And there are nodal points in our body which are full of keyholes. Hippocampus, amygdala, periaqueductal gray, which I will talk later, endocrine glands, gastrointestinal tract, dorsal ganglia of the spinal cord. So looking at this list, every embodied practice may activate psychosomatic network, and you can hack in. Periaqueductal gray, this is the structure in midbrain, very important for breath workers. When it's stimulated, you release endorphins. Yeah, and it is a lot of endorphins. It's responsible for conscious breathing, vocalization in mammals, rhythm of speech, pain modulation, and maternal love. It causes the hypothalamus to excrete oxytocin. So conscious breathing is love. Conscious breathing is bond. Conscious breathing is free expression, and conscious breathing is catharsis. Putting this neuroendocrine jargon into words of therapy, into the words of normal people. Yeah, so you can do it by yourself. Yeah, you can enter your inner world and change everything. That is why I started breathwork integrative psychotherapy approach, and I started grand research panel. I will present it next year. Due to COVID, I had to, it was rescheduled, but here, for everyone who will be watching it later, here are the details below. I want to thank all wonderful people who have believed me in 2007 and 2008 and has helped me a lot. Yeah, 500 procedures of blood drawing, for example, it was, imagine. So here you have the abstract, but what I would like to tell you, after 10 deep breathwork sessions, breast cancer patients had many changes in their mood and one important change in their immunity. The group which is in blue here, they have therapy, verbal therapy with me and normal relaxation, so they spend the same amount of time as me, as the red group with me, but they didn't have breath work. What happened? If someone is familiar with this test, you see a whole group was not depressed. Okay, that's why there is no this significant drop. But here, they were anxious, and both groups benefited from psychotherapy. But breathwork group had significantly lower anxiety at after 10 sessions, and this change was stable. So when they had sessions, they released anxiety, and their aggression, irritability diminished quite fast after 10 sessions, and later on, more conscious breathing means less hate, less irritability, less aggression. It's important. I'm showing you just a part of this database. It's 400 data, okay? So it's a bit for you, for practitioners. Anxious preoccupation, can you see how it has dropped after breathwork session, and it also it was more significant in the breathwork group. But you can also see that normal therapy also works, okay? My breathwork patients maintained high positive evaluation of the disease. That means existential change due to the disease. The red group maintain this insight they had at the beginning, so the treatment didn't change it. When people have radiotherapy, their white blood cells are dropping if the radiotherapy is taking long time and is covering a larger part of the body. In case of breast cancer, it's a little bit, yeah, which is covered. And overall lymphocyte population, lymphocytes are a subclass of white blood cells. They had dropped significantly in both groups. But what happened with natural killer cells population? Can't you see this? You can see here regeneration above the level of baseline. Yeah, breathwork group were able to have more natural killer cells than control group, and it was better than at the beginning. Ladies who had chemotherapy, of course, they had less natural killer cells than those less advanced, but in general, effect is visible in everyone. And in experimental group, natural killer counts increase happened in 72% of the group, and the same thing happened only in 1/3 of the controls. And it depended on different factors because it's a multiplied regression here. So you can see these things are totally different. And the bigger rise in blood pH was during the first 10 sessions, the better, it was the better. So please breathe. If you have cancer, please breathe, find your breath worker and get alkaline. Okay. My group maintained higher pH during this research, during this study. All ladies were eating more or less the same. It might be important. Well, it's complicated. Science is complicated. And what happened after 3 months? Ladies who had breath work, they had higher partial oxygen pressure. It took many months, but it finally happened. You cannot develop your physical form, you cannot get better physically in 1 week, okay? So it takes time, but it works, yeah? Partial carbon dioxide pressure changed in both groups, but these things are not very significant. What happened with the stress hormones, prolactin and cortisol? When you see here, nothing really happens. But what happened during the session, during the 10th session of breathwork? Here you can see blood pH is going up, partial oxygen pressure is going down because they are alkaline, carbon dioxide is going down, stress hormone is going down, and prolactin is going up. Prolactin is provoking natural killer cells to being more active. So this is this research, and we have a little bit, few minutes for questions, so I'm waiting.
Oh, thank you, Alicia. That was an incredible presentation. We have got some comments here. They love the glove idea.
Yeah.
It's great. During lockdown, I had triple doses a day to lower footfall in hospital. That's from Rosie. Of radiotherapy for breast cancer, I breathed every day and I had no side effects. And then there's a question from Aggie. She says she's loving the session. Alethea is amazing. Would like to ask about how to tackle resistance when people cognitively want to try things and do things differently, but part of them resists, i.e. fear of vulnerability being helped.
Okay, that's a great question. Breathing is, conscious breathing is reducing resistance. It was discovered by Wilhelm Reich and Alexander Lowen, yeah, from bioenergetics. So if people do not want to work at all, I can't do anything. I can't do things for them. But I sometimes ask, oh, maybe you would try something fun. Just breathe with me. You know, your immunity will like it. I'm talking a lot about science. People will fall into the trance and then they follow into breathing, or if they are conscious and they like science, they follow anyway. So I work with about 1/3 of my clinic. 2/3 are looking for being calmed down, a little bit supported. It's not deep. Deep change is not for everyone, and we need to accept it.
Thank you.
Yeah.
Yeah, thank you so much. I mean, I was just struck by how difficult the environment is for patients, and how radical, that really what you're saying is, people need to be kind to themselves, and that's almost a radical idea in the medical format. So it's incredible that you for you to say that, for me, was just so striking. When people are like beginning their journey with this disease, how are you helping them to sort of focus on themselves with that situation?
I'm talking about their family situations. I'm checking if their needs are met. I'm checking if they are feeling safe, yeah? If their children are safe. We need a safety net of our bonds. And if they are not safe, or if they are heavily addicted, we need to start repairing things before the treatment starts.
Mm-hmm.
Alcoholic may fall into delirium if not treated
Right.
after the operation.
So you're really focused on making sure that they have that base level of stability before they even begin treatment.
Yes, I saw a question about breathing. When I talk about coherent breathing, I'm talking about usually 5 seconds inhale and 5 seconds exhale. It gives you the best possible oxygenation without constriction of small vessels, okay, medically. And it was checked by the scientists. It will give you the hypertension reduction of 10 points and more, but you need to do it 15 minutes a day. And I ask my patients, you are starting treatment, please, let's start with the breathing, 15 minutes, try 5 minutes, try another 5 minutes, 2 hours later, then try 10 minutes. Don't be afraid of tingling. Yeah, tingling is a sign of lowering carbon dioxide levels, and it's not dangerous.
Great.
Yeah.
I've got a question from Rosie, who's asking, does breath work help with side effects of drugs or for breast cancer, e.g.
Tamoxifen.
Yeah.
Tamoxifen, yes. And all embodied methods will help you with the heat you may feel after taking tamoxifen. It's like during menopause, you feel this wave of heat taking all over you and you're boiling. So breathing can help you out. Also hypnosis, yes, and behavioral techniques. It was proven scientifically. I saw research on that. Anything in therapy that will seem to help you is worth trying. I would try with regulating vagus nerve. Because breathing coherently gives you ideal work of your vagus nerve. Balance, not too passive, not too aggressive. So let's start from the beginning. Have a balance and breathe. You may focus on your feet because when you feel a heat wave due to tamoxifen, people are women, also a men who have breast cancer, they feel the heat going up. So focus on your feet and breathe and give yourself time. So body adapts with time, over time.
Great, thank you. Another one from Aggie, who's asked, you've witnessed so many people passing. What have you learned about life through this experience, and what is your advice for those who are losing someone to cancer?
I have an impression or an insight that life is precious. A lot of my juvenile neurosis just fell apart after I started working at the cancer center. I'm an old Buddhist, so definitely I work with impermanence of things passing by. So being in this place is natural for me, or experiencing losses. It's a part of human existence, yes, of a passionate human existence. Avoiding loss, avoiding impermanence will put us into the sort of narcissistic limbo. So not avoiding experience. This is my idea. When someone has cancer and you have to deal with things passing by, impermanence, and awareness that nothing is permanent. Yeah.
Thank you. Yeah, that's not an easy thing to do at all.
No, it's not an easy. It's simple, but it's not easy. Just like breath work.
Yeah.
Yeah.
Thank you. And we've got a question here as well about from Iwona. What is the medical effect of prolonged exhalation?
Prolonged exhalation gives you the activation of parasympathetic system. So the longer your exhalation is, the stronger is activation of, let's say, relaxed center. But to be honest, if someone is very traumatized, this person cannot relax and switch to safe parasympathetic mode because this person is frozen, it's shaking, and is just a distressed mammal. You cannot just relax on longer breathing. That is why I suggest equal inhale and exhale, as I don't know who you are. Yeah.
Yeah, thank you.
Thanks.
So we'll come up to the sort of end of the session now. I'll just wrap up with some announcements. And when I'm finished, we'll come back to you with your final tip or word for the embodiment conference.
All right.
Thank you so much.
Thanks so much.
So thank you everyone for being at this session. You've been with Dr. So I've lost my paper now. Alicja Heyda. And just thank you for all the amazing information. It was such an incredible piece of work there. So what you can do now, if you want to unpack the information, you want to share with others about what's been going on for you, there are the coffee break sessions and the Facebook groups. They give you a bit of time to connect with other people who've been in the sessions or in other sessions, and you can share about what you've learned here, or hear from others about what they're experiencing. There's also an opportunity to own this library. It's a chance to take time, digest and process all of the amazing things that are on offer here. You can have learning lists which can take you through progressively and logically the information that you've been finding here. And you can also have the audio only format, which means that you can just listen and get on with doing other things if you don't have time to sit around and watch a video. If you buy it while the conference is on, you get it for 50% off. And it's a great big thank you to the people who've worked hard to put this conference on. And it also makes it free while it's on for people to watch who can't afford to own the conference themselves. When you buy the conference, it is a lifetime ownership, so you don't have to worry about getting through them in any particular time. It's all just there for you when you're ready. Alithia's website should be in the links that have been posted in the chat for you, so you can get in touch with her or see more about her work there. And yeah, that's it. Back to you, Alithia, for your final word and tip on embodiment.
Okay. Every single minute of exercise which is done regularly is more precious than one long session once a month. So please practice everywhere. You can see my YouTube channel with films and lectures in English and Polish, and also my fan page. You can join me on LinkedIn or check on my articles on Facebook for scientists. I mean ResearchGate. Join me on the ResearchGate. All right. I don't have a regular website. Thank you so much. It was great to see you and to be here with you. Thanks a lot.
Thank you so much. That was
so
amazing. Thank you.
Wonderful. Bye bye.